The majority of the cases that I see are patients who are sort of at the end of their rope. You know, they either have been told by many different types of practitioners that they can't be helped, or they're told you have to take this medication for the rest of your life. You have to suffer with these side effects, or you have to have surgery, which may or may not make you better. You know, Chinese medicine is very powerful. I mean, I've been very blessed that every patient that I've ever seen has become at least 50% better. But even that being said, you know, throughout that time, I realized that if I were to have practitioners of different modalities working with me, with those patients, their care would be exponentially more effective and therefore cost effective. There's a lot of people, as an example, who maybe they need mental health counseling. I'm not trained to do that, but I can find someone wonderful who is trained to do that, who can help. Someone who needs, you know, physical therapy or neuromuscular therapy or massage. I mean, physical medicine, I'm not trained to do that, but I can find some wonderful people who can do that and can help. I have this wonderful, wonderful woman who she first came to me because she had knee pain. She has knee pain because she's overweight and has diabetes. And she, through getting to know her over that year, she's overweight because she has some emotional issues. And within maybe the first 3 weeks of me seeing her, I've seen her pretty much every single week for a year. And within the first few weeks I could tell, you know, I really think that you need to go talk to someone. So I made the suggestion to her and she was open, but it wasn't convenient for her. She, because of where she lived and her time and other factors in her life, she just couldn't make that next step. Maybe it wasn't the right time. After seeing her, you know, again for a year, I hired Shawn Harris, who's an amazing, I mean, she's just, I feel so blessed to have her in our clinic. So she's one of our other practitioners, and this woman, you know, I told her, well, hey, you know, we've talked about counseling for a while. I now have a counselor in my office. Do you think that might be something you might want to do? And because of the convenience and because I had hired this person and she knew I trusted them, her demeanor changed immediately. Oh, absolutely. And she went the next opportunity she had the very next week. And when this patient left my office after that first visit, she was literally skipping out the door. She was smiling and she was happy. And that's something that I never could have done on my own. So the practitioners don't just occupy the same space. They have to actually communicate with each other. They have to actually learn from each other. They have to be willing to listen to somebody else's perspective on health and trust them and respect them for their perspective and their way of treating patients. If you can actually create that environment, which I'm trying very hard to do, if you can actually create that environment, then patients will have more effective and therefore cheaper care. So the way that we generate integrative care here is kind of multifold. You know, on the one hand, all of the providers are my employees, so what that means is that I can kind of tell them what they have to do. You know, it's kind of like having a captain. So, so there's that aspect. Another aspect is we have a very extensive integrative referral system within our center. So we have these very specific forms that get filled out, and we have a very intricate communication from one practitioner to the other. We come together and we talk about specific cases, and we brainstorm ideas. We share evidence-based practice and research, and just ideas, basically. So that's probably the central place that the integrative care actually happens. I think a lot of times people are a little wary of purchasing healthcare. or, you know, getting the care that they need, because they either feel like it's not going to be the care that they need and they're not going to be helped, so why bother? Or they feel like it's really expensive, which sometimes it is really expensive. It's not worth, you know, it's not worth the effort, those kinds of things. So these free lectures are an opportunity for the public to just come and meet us and get to know what we're about. And we have a different practitioner giving a different lecture every week on Wednesdays. And, you know, it's just an opportunity to get to meet them in a, you know, no obligation kind of way. It's really important to me that people get the health care that they need. I mean, for me, in my mind, health is a basic human right. It's food, water, shelter, and health care. I mean, the mere fact that we're alive means that it's a basic human right to be able to subsist and to persist and thrive within our health. And healthcare is the way that that happens. So it's, I mean, I'm always trying to think about ways to make it better, more effective, and more accessible for people, because it's really, really important to me, you know. So, and it's cool to have to be given that gift, to be able to do that for people. I mean, that's a really amazing gift. I get to do that every single day. And I get to be the director of this center, which means that I get to guarantee that at least here we do it compassionately. At least here we do it affordably. At least here we do it effectively and with your best interest in mind. I mean, we're here in service of you. It's not the other way around. You know, we're here in service of you and your health and your best health, which is really cool.